reasons why we have low back pain, and what I'm about to show you is one of the more common reasons. In this schematic over here, we see the lumbar vertebrae, and this little guy down here is the sacrum. As long as the vertebrae are in a nice straight line from each other, there's usually not very much pain. Let's see how that compares with this other schematic. In this schematic, you see that the lumbar vertebrae have been displaced forward, and here we have a little square step on the bottom. This is a condition that's called a spondylolisthesis, and yes, I realize that's a long name, and so for short, we usually just call it a spondy. Now, a spondy can happen at any of the vertebrae along our back, but this place between the fifth lumbar vertebrae and the sacrum is probably the most common. Here's where the pain comes into this whole process. We have ligaments that run the whole length of the spinal column, and normally if the ligaments are in a straight line also, there's usually not so much of a problem. But in this case here, we see that as the vertebrae is displaced forward, it stretches the ligaments. As a matter of fact, the more the ligaments get stretched, the more pain we're going to run into. Let's see how this plays out on a real patient. There's a lot of things that cause spondies. Digestive disorders is probably the main one. In this particular case, this is Britt, and she had a car accident, and that's the reason why she has hers. Say hello, Britt.
Hello.
Okay, and this is Britt's spondy right here. Her lumbar vertebrae are down, and her sacrum is up, so that they look just like the diagram that we showed. If I feel in this area here, I can actually feel the square step. If I push in here, how's this feel?
Ow.
Sorry about that. And how about this side over here?
Not bad at all.
I can feel that this side has more of a nice curve, and this side here has more of a square step to it. Now there's a lot of ways that we can fix this, and I have one way that I particularly like. What I do is I use my SOT blocks, and I put one block underneath this side here, and one block underneath this side here. And what that does is it starts putting pressure to raise the lumbar vertebrae up. The next thing I do is I have a drop table that I use. I lift the table up about this far, and when I push, the sacrum is going to slowly go down, dunk, 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 until they're level again. Let's see how this works. I'm going to use a scooping motion. I'm going to push down, and let's try that again. And I can feel the sacrum going down. One more time here. Now I'll change positions, and instead of pushing, now I'll pull and get the fine tuning in there. And we'll know how to do it. Okay. How's that feel now, Britt?
That feels better.
Yep. And you can feel there's just a nice smooth curve there instead of the square. That's all there is to it. I hope you know a little more about spondies now than you did a couple of minutes ago. Spondies are a lot more common than most people realize, and I know because several of my patients have them. If you have the kind of low back pain that Britton was having, you may have a spondy too. Oh, one other thing. Don't be trying those kind of adjustments at home like I did. If you don't know what you're doing, it's a good way that you can unnecessarily hurt somebody. So until next time, I'm Dr. Wayne. Play it slow, but also don't forget to rock on a little bit.